Looking for a professional near you? Just head to the Gray Institute homepage, tap Locate a Professional at the top, enter your zip code, and find a certified provider in seconds.
Have you ever felt a sharp pain just below your kneecap when going downstairs? Or maybe your knee feels unstable during cutting, jumping, or even walking. Whether it's patellar tendonitis or an ACL injury, knee pain is incredibly common, and it's usually not just about the knee. Here's something most people don't realize. Knee pain is rarely a knee problem. It's often a result of dysfunctions elsewhere in your movement system. Here's one simple strategy that can help reduce pressure on the knee. Stand on one leg and comfortably reach your opposite side foot forward and backward, to one side and to the other side, and rotationally one way and rotationally the other way. This activates the two best friends of the knee, the hips and the feet, while engaging the core, distributing force throughout your body, rather than just dumping it onto the knee. If this feels difficult, wobbly, or even painful, it's a sign your system might be overloading the knee due to limitations elsewhere. Patellar tendonitis and ACL issues don't come out of nowhere. They're often the result of a chain reaction, a breakdown in how your entire body absorbs and transfers force. At Gray Institute, we've identified the three most common contributors. Number one, poor hip control and mobility. When your glutes aren't functioning properly, the knee is forced to absorb more stress than it should, especially during deceleration, landing, and direction changes. Number two, limited ankle and foot mobility. If your feet and ankles can't load and unload properly, your knee compensates. That increases tension on the patellar tendon and the ACL. Number three, incomplete three-dimensional strength and loading. Real life and real sports don't happen in straight lines. If your training doesn't prepare your knee to move and stabilize in all three planes of motion, you're at greater risk. Ignoring the root causes and just treating the knee may help in the short term, but the pain usually comes back. That tightness around your kneecap or instability after an ACL repair is often a sign that other areas aren't carrying their share of the load. That's why applied functional science matters. It looks at the whole body. It considers the chain reaction of motion, and it helps you recover and perform smarter, not just harder. This is the exact approach used by Gray Institute trained professionals across rehab, sports performance, and personal training settings. If you're struggling with persistent knee pain or trying to bounce back after an ACL injury, start by asking the right questions. Are you being assessed in an integrated fashion, especially by including foot and ankle and hip motion in all planes of motion? Are you building strength with functional loading patterns that prepare you for all aspects of life? Are you being treated and trained by a movement professional that is certified in applied functional science? These are signs that your provider is looking at more than just the joint, and that you're trained to treat the cause and not just the symptom.